Our original plan was to begin the story in 1945. But like Topsy, it just took on a life of its own, gradually moving back to 1930. I have to confess, there are even a few elements of the story, Ruth would say good stories, that begin in the 19th century. And we never left out any good story, no matter what period it appeared in. As its title suggests, the exhibit is played out in 3 acts. A period of traditional practice, a transition between 1945 and 1960, and a medicine based on a high level of science and technology in the years following that. The earlier period is often viewed as an heroic age of dedicated physicians traveling great distances, often under adverse circumstances, to meet the medical needs of their patients. Now, that's I think, probably a reasonably accurate portrait, but the comparison might also be made with the Lone Ranger. For the doctor was alone in his struggle once he got to those patients, alone with little more than his experience and the bare bones contents of his black bag. And when you look at the distribution of physicians at the turn of the century, you see that they're located a good buggy ride distance from one another. That's just about where they're located. Just to take one example, if you move up the Keswick River, there was one physician at Keswick Ridge, there was one physician above Burt's Corner, and finally there was one in Millville, probably looked after Southampton as well. But you can see these are reasonably distinct, circumscribed areas. And that had been a practice for a long, long time. Hospitals became the central agencies for change. During the 20th century, they gradually shred their somber image as places to go to die, which has been a characteristic of 19th century hospitals. Changes in the practice of medicine, when they occurred, increasingly centered on hospitals and on cooperative efforts with other health professionals. The movement was accelerated in 1948, and that's the key date, 48, with the implementation of the National Health Program funded by Ottawa. And I have to confess, until 2 years ago, I hadn't even heard of the National Health Program funded by Ottawa, but it was crucial to what happened here. In quick succession, just to give you an idea what happened once that program came into effect, in quick succession, the Victoria Public Hospital Cancer Clinic was created. And after that, they went to a free cancer treatment program. We think of these programs as being something that happened after Medicare, after hospitalization. But in fact, a decade before that, you could get diagnosis and you could get treatment for cancer for a fairly prolonged period of time, subsidized by the federal government. The Fredericton Mental Health Clinic was formed about the same time. The Fredericton Regional Medical Labs were created for the first time here, and they're crucial, absolutely crucial to any diagnostic service. The polio hospital was built with federal funds. The rehab center was built with federal funds. X-ray therapy and X-ray diagnostic machines were brought to Fredericton, supplementing some of which, to the Victoria Public, supplementing some of which were already there. New hospitals were built at Stanley, Fredericton Junction, Minto, Harvey, and very significant extensions were made to the Victoria Public, all within a decade, all following 1948. This culminated in 1959, of course, with the Provincial Hospital Insurance Program, which provided universal coverage for all New Brunswickers. you have to remember, of course, is that the lion's share of the costs, I figure about 60% of that program, were borne by the federal government, which has been backing away from it ever since. Most of the new clinics and services were run out of the Victoria Public Hospital. Increasingly, medical care was done by teams of experts, whether medical specialists or nurses or paramedics or medical and lab technicians. In this system, general practitioners had a full arsenal of diagnostic resources, techniques, and treatments to deal with, to draw upon. Doctors came to work out of collective offices. Indeed, many worked out of hospitals. And in the interests of efficiency, patients came to them rather than their traveling to the hospitals. Hospitals then became centers of medical infrastructure, containing the laboratories, the surgeries, the sophisticated technology, and the developing worlds of vaccines and antibiotics. You just have to compare it to what was being done in the 30s and 40s, when all the vaccines, I was going to say all the vaccines in the city, were handled out of Staples. The doctors went to Staples drugstore and got particular vaccines that they needed for particular patients and administered them in their offices. This is such a transition. Fortunately, I can't knock this mic over. Finally, in 1971, the province joined the federal Medicare program, and Ottawa covered half the costs there. In the first 3 months of the new program, 327,000 claims were made by New Brunswickers seeking doctors' assistance. 327,000 in 3 months. And the province, as a result, hired 97 civil servants just to process the claims, 97 additional civil servants. In a scant 20 years then, well actually 23 years, the transformation was complete. The scale of the change can be measured in the growth of diagnostic lab tests, which are essential. In 1945, there were 91,000 tests for the entire province, most done for St. John, a very large proportion of them designed to diagnose syphilis and gonorrhea. By 1975, there were 750,000 tests being performed in the Fredericton lab alone. And the important thing isn't just the numbers, it's the fact that such a range of new techniques, testing for new conditions, new situations. The impact of the new medicine can be measured by mortality rates among children, among childbearing mothers, and among middle-aged men. Traditionally, as you know, the highest death rates were always among young children, historically always, followed by women and by middle-aged men. The results in the Fredericton region, which you can see in the exhibit, if you're not too statistically challenged, range from spectacular to very significant. I can tell you one, deaths of mothers during childbirth, at one point at least, by the 90s, was completely eliminated in the Fredericton region, which was quite startling if you compare it, for example, to the 1920s or 30s. And we won't even begin to compare it to 50 years before that. Certainly, the changes were sufficiently great, sufficiently large enough to warrant a demand for most communities today that they have an ER. And if you happen to be in politics, you'll understand that quest for an ER. But it's understandable if you see the stats on it, why it's important. In fact, I would argue that it's enough to ask If you live within 3 miles of an emergency room, it's enough to ask that your insurance company give you a premium reduction. If you can get there in 3 minutes, your chances of survival are not bad. The changes in the culture of medical practice since 1940 have been profound. So too has been the impact of this institution on the Fredericton region and on the social order of the Fredericton region. As you examine the exhibit, I would urge you to look for the influence of federal financing, the growth in medical specialization, the fall in mortality rates, and the significance of the diagnostic services, which have done so much to keep us all going, even at my age. Thank you very much.